Hello, everybody. We're going to be starting this live a little bit earlier than what we announced, just so we have enough time to cover everything. For those who are just tuning in now, my name is Jovana. My name is Jovana Lekovich. I'm one of the board-certified OBGYN doctors and infertility specialists. I practice in New York City, in Manhattan and Brooklyn, and I have a great pleasure of presenting you today a good friend of mine, Blandin, who is the founder and the CEO of Fertility Yoga. We're just waiting for her to send me a request. Here we go. There she is. I hope everybody's doing well. It's pretty hot outside, but this is the summer, so this is what we wanted. Oh, hello. Hi, Lauren. How are you?
Hi, how are you?
Good to see you.
The door open and I should close it.
Well, welcome, and thank you so much for finding the time to be with us today and to tell us so much about what you do and how do you help people who are going through treatments or who are struggling with infertility. I think that you found a very unique way of doing so because, and obviously, this is what's going to be the bulk of our conversation today, but I think that we make it so harder, especially for patients who are going through treatments and specifically going through IVF. We as doctors usually advise not to do exercises because of certain potential risks for ovary twisting and resulting in a surgical emergency called ovarian torsion. However, any metabolic situation, specifically going through stimulation in order to recruit multiple follicles to grow and to be able to retrieve them, requires that your metabolism is running and functioning properly. And for many people, that assumes exercise. And it's so hard for a lot of my patients when we tell them that they shouldn't be exercising, or at least shouldn't be doing certain exercises, because they know how important it is for those who are, as a tool to struggle with anxiety and depression. So I'm so excited to have you. And would you mind telling us a little bit about yourself, what you do, and how did fertility yoga become to be?
Yes, for sure. Well, thank you for having me. I'm very excited to be here, especially with you because you're my doctor. Really,
Can confirm.
and this really is how this came to be for me. So when I was going through fertility treatments, I was chatting with you, and you were the one who informed me of ovarian torsion and what that is. And maybe just for a minute, if you just want to tell our audience a little bit.
Of course. I mean, first of all, let me say that, knock on wood, I have never, in over a decade of doing this, I've never witnessed one. I hope never to witness it. But we know that theoretically, ovary is a very small organ. It's about 2 to 3 centimeters. It's flat. It weighs about 20 to 30 grams. But whenever an ovary contains a tumor or a cyst or multiple follicles growing, which is what we see in the setting of controlled ovarian stimulation for purposes of IVF or egg freezing, we know, the ovary gets a little bit larger and becomes heavier. So it starts to respond to gravity slightly differently than it would be when it does not contain any of these structures within. And so theoretically, at least, we know that for sure if there's a big cyst or a tumor, and theoretically, if there are multiple follicles growing, we know that with a certain movement of the body, the ovary can be pushed in such a way that it basically can twist. And by twisting, ovary can it twists around the 2 ligaments or around the stems that are bringing the blood supply to the ovary. So theoretically, that situation with the ovary twist can result in ovary basically cutting off its own blood supply, almost like a heart attack of the ovary. And it is treated simply by basically untwisting it surgically, but it does require surgery. And in a classic sense, it's a little bit harder to diagnose. Usually it's presented by severe pain, nausea, vomiting, but sometimes it's harder or easier to diagnose it. And, sometimes a patient, if not recognized, sometimes a patient might sort of lose that ovary because if the blood flow is not restored within a certain period of time, the eggs might die. So as I'm saying, I've never seen this, and I really hope never to see it in the setting of controlled ovarian stimulation or after the egg retrieval. I've seen a lot of them as a resident. I operated a lot of them as an OBGYN resident in the setting of a tumor or a cyst. But because of this theoretical risk, I think that we just generally advise no exercise of a certain type. And by doing that, we really deprive patients of a very important tool that helps them, not just stay healthy and be at their healthiest, but also, being able to cope properly with their anxiety.
Mm-hmm. So,
Yes, tell us about your experience. And you must have hated me when I told you no exercise.
it piqued my interest, and at the time I was taking anatomy and physiology in school, and so I just dove in wanting to learn more. So the catalyst for this, there were three things. Number one was the physical, which was I knew that my yoga practice was going to help me, but I also knew, given the style of practice I was practicing at that time, it was very physical, very demanding, and there was just no way, given this potential risk, that I was going to be able to do that. So I wanted to be smart about what I was doing for myself and my yoga practice. The second was that, I've been practicing for over 20 years, and so while I knew I had to modify my practice, I also knew that this was going to help me. All of the things that I've learned and gained, all the byproducts of yoga, such as patience, compassion, forgiveness, softening, slowing down. These were the things that I was really going to need during this time, and I didn't want to completely abandon my practice at that time. So I took with that being said, when I started to research the information that was out there for fertility and yoga, there was virtually nothing out there. I was really amazed, considering how popular yoga is, and also with the amount of people that are going through fertility treatment. So the fact that this really hadn't been fused was a real surprise to me. So pardon?
No, I said I agree. When we talked about it, when you were just establishing your organization, I remember that you sort of asked me a few questions about it, and I really have never heard of it before. So I really am happy that this inspired you in a positive way, I guess.
So I took my nearly 2 decades worth of practicing yoga, and I modified it in order to support what my body needed at that time. And I focused on restorative yoga, which is taking relatively simple postures. You support them with props, and then you hold them for a longer period of time. And this evokes a very specific kind of response from your nervous system. It's activating your sympathetic nervous system. So when you're in that fight or flight response, your blood is leaving your reproductive organs. It's going to, your muscles, your heart, so that you can run away from that lion.
That's right.
But when the parasympathetic nervous system is activated, all of the blood, the oxygen, the nutrients, they're going to the reproductive organs. And it's also sending a signal to your brain. The vagus nerve is being stimulated so that you feel safe. And there are so many things in this process that I think cause people to feel a lack of control, that when you are able to physically evoke that feeling of safety, it really does something to your brain and allows you to approach this from a different place.
It's really so amazing. I'm a physician and a surgeon, but I never thought of the stress from that standpoint, actually, that it really does direct blood flow to your brain, to your heart, to the organs that need to get you out of that, dangerous situation. And by doing so, your blood flow through certain organs, including uterus and ovaries. Even kidneys are not going to be perfused properly. That's why, these reactions can't lead to a shock or kidney failure. But it's a very interesting point that you're making. Thank you for bringing this up. I think it is incredibly important. So what do we do about it?
So what we do is we get on our mat, and so the style of yoga, of fertility yoga, is, like I said, practicing in a quiet, dark setting where there's not distractions, where there's not noise. you use these yoga postures, which again are very approachable. Whether you're an experienced practitioner or an absolute newbie, anybody can do this practice. And you take these postures and you hold them for a longer period of time. And it's the combination of the support and the duration of time that you're holding these postures helps to cultivate this sense of ease, this sense of relaxation. And I think most importantly, or what's important to remember is that, you know, we can't change certain circumstances. But what this practice does teach us is that we can respond in a different way. We can react in a different way. And I think that, you know, whatever the path might be for people who are on this journey, I think that's something that all of us can take with us, is that, you know, the circumstances don't always change, but our response and our reaction does.
That's so true. That's so true. And, you know, you're really educating me now, because I used to do yoga when I was in high school and in college. And, you know, I went to exercises with my sister, but I really thought, and, you know, for the longest time, is that yoga is just a physical thing. It's just a type of a sport to keep you physically healthy. But what you're saying is that it seems that there's much more to it on a mental level as well.
For sure. And that's where, so, you know, and everybody comes at it from a different door. And that's the beauty of it, is that no matter where you are, the practice can meet you where you're at. And so for many of us, we do start with the physical, because that is what is most immediate. That's what's most available to us, our physical body and our breath. And when we can combine the two together, it has an effect on our mind. So when you learn to breathe in a very slow and methodical manner, again, it helps to slow down the brain waves, helps to quiet the mind. And again, it allows us to stand back and just view things from a different point of view.
Yeah, absolutely. I wanted to ask you, I mean, we kind of touched upon that a little bit, but it seems to be unclear, at least in literature, whether the stress and fertility or infertility are related. We certainly know that being stressed out or coming from a place of stress does mean certain biochemical reactions. We know that the concentration of certain hormones, including cortisol, including glucagon, including insulin, including growth hormone, are going to be elevated in our bloodstream. And obviously we know that stress is an important culprit of many conditions, including high blood pressure, potentially cancer, cardiovascular diseases. I think what makes it harder, even though I do think that indisputably stress is related to how a person would respond to fertility treatments, or in some most severe cases of stress, such as, you know, I had patients who unfortunately have lost a child. That kind of stress can cause blockage of the pituitary gland and, you know, lack of ovulations. And I've definitely seen it in my practice. Then on the other side, you know, we know that thousands of babies have been conceived in concentration camps. And we know that, you know, talking about stress in certain parts of the world where there's no water or food or safety, infertility is not higher. So how do we reconcile this? And how do you think, I mean, clearly it's not going to be helpful. For some, it could be the very culprit of infertility. But I think what a lot of people struggle with is when they're told, just relax, you know, it worked for my friend's daughter. Exactly. So, but, you know, indisputably, we know that, you know, is it a chicken or the egg? We know that a lot of patients who have infertility, that is male factor, or tubes are blocked, or have fibroids, or don't ovulate, over time can develop anxiety and depression, especially going through treatments. How do you think yoga and all the elements of it, mental and physical, can be helpful? And how do you find it in your clients? Do you find it to be helpful when they're going through treatments? Do you find it to be helpful for those who are trying to conceive naturally?
Yes to all of the above. You brought up a great point, which is, you know, is it the chicken or the egg? Does stress cause infertility, or does infertility cause stress? And regardless of what the answer is to that, people who are trying to get pregnant and are having difficulties doing so are stressed out.
Right.
And so just acknowledging that is a huge component in all of this. I read something. I actually read a book earlier in the summer called When the Body Says No by Dr. Gabor Mate. And he talks about the four major causes of stress. I have a little note here I'm gonna read off. And
Yes,
it's
please.
number one, lack of control. Number two, uncertainty. Number three, emotional isolation. And number four, inability to express emotions. And it was so interesting because when I was reading this book, it was the height of the pandemic. And I was thinking to myself, is this COVID or is this infertility?
Yeah,
And
right.
I mean, but really you read this, and to me, that just sums up the fertility journey, all of those factors.
So true.
So when you are working with emotion, emotions have to be processed through your body. We have to get out of our brain and into our body, and that is how we filter emotions out. So it's coming back to that quiet, dark space. You know, when we lay horizontally on the floor, we are less triggered. So again, it sends certain signals to our brain. You know, like when we lay down, that's when we know, okay, we're gonna chill out, we're gonna go to sleep. So these are all different ways to trigger our brain to elicit a certain response in our body. When you're taking specific practices, such as the yoga, such as the deep breathing, all of these, it's a accrual system. It's a compounded effect. And so when you practice these over a period of time, it helps to down-regulate the nervous system, turns on, activates that vagus nerve, and we have that feeling of safety and support. And that then allows us to approach things with ease, with kindness, with compassion, and for those of us and for those people who are struggling or who have had a challenging time, it's life-changing because this is all-consuming.
Yeah, I couldn't agree more. I think that definitely going through infertility treatments, and I mentioned this so many times, there's a big study done at Harvard, and there were a few smaller ones that use validated surveys to assess anxiety and depression, and the magnitude of these mental, challenges. And it has been shown that for those struggling with fertility or going through treatments, the amount of stress and depression were parallel to those found in patients who are facing a malignancy or a cancer diagnosis, young individuals. And, infertility is a medical condition as defined by World Health Organization. And probably for young individuals, it's probably the most common serious medical condition they're facing. So tell me, is there a specific type of yoga? Do you think that those either who are trying to conceive or who are going through treatments should be practicing?
Yes. I want to be really transparent here that not all yoga practices are equal. They're not all the same. And like I was saying earlier, different practices evoke a different response from your nervous system. So I would say that if you're not being stimulated in some way, you can do a regular yoga practice if you practice regularly. I would say focusing on hip opening would be very conducive because again, you're focusing the blood, the oxygen, the nutrients to that area of the body. However, once you do start becoming stimulated and your ovaries do start growing, I really recommend practicing a restorative style of yoga, such as fertility yoga, which is what I'm teaching, because it puts you in this position. You're not going to be doing any deep forward folds, any twisting, and these are the things that can create that medical emergency, that tubial torsion. So we're just taking that out of the equation altogether, and placing people in postures that are calming, restorative, but also, and most importantly, safe. You're not going to be going into any positions that are going to compromise those growing ovaries.
I'm sure that wasn't easy figuring out in your course because, a lot of the positions will be using lower body and sort of stretching and twisting, but maybe we can, I guess we'll leave your contact information at the end so people can sort of learn how to safely practice yoga even as they're going through infertility. But I would love to see, love to see those positions. I'm sure it was, it's kind of like, oh, what do we do now? And I'm sure you found some interesting and amazing solutions for that. But
one thing that I wanted to say about what was in the back of my mind when I was creating all of this. So when I first came up with this idea, so number one was the physical, wanting to create a practice that was safe. Number two, it was knowing that the stress relief that I gained from my practice, I really wanted to maintain that while I was going through fertility treatments. And number three, it was community. So when I decided to go through fertility treatments, I had all the emotions, right? But most definitely was shame, embarrassment, all these things. And I didn't know anybody who was going through this and didn't feel like there was anyone I could talk to. However, I will never forget this. I remember the morning I walked into the clinic for monitoring,
right.
and filled with other women. And I was like, oh, I am so not the only one who's going through it.
True.
But it was also a good reminder of that, I can't be the only one who is experiencing these emotions, and that women need a place, a refuge of shared experience with other women. And that also was a catalyst for this, wanting to create a space where women can come together to share in their experience. And, you walk away with friendships, and you walk away feeling less isolated, less alone, and that, you're in this with other people. And I think that is another psychological component in all of this. It's very important.
Yes, I agree. As our therapist at RMA, Rena Gower, likes to say, it takes a village to raise a child, but it also takes a village to create one.
Absolutely.
And for so many of us, it's so true because, a lot of my patients are, there's specific triggers, as that, you might be having a Thanksgiving dinner or lunch with your family, and everybody's asking, when is the baby coming? What are you guys thinking? And you're like, I'm on my 4th IVF cycle. I just don't want to talk about it. And you cannot really talk about it. And so in a lot of times, that community has become a family for so many of us, because your other family or friends are not maybe good at understanding what you're going through. And so sometimes for the duration or for the time being, they get replaced by, infertility community. There's so many wonderful resources and wonderful groups, support groups on Facebook, on Instagram, on LinkedIn. I'm a member of all of them, and I'm learning so much from all of them every day. Now, let me ask you specifically, and we got a question from the audience, which I think is a great question. Obviously, going through controlled ovarian stimulation for purposes of maturing multiple eggs and retrieving multiple eggs is only one of the aspects of the treatment, right? And that's where we need to be cautious for those couple of weeks in terms of twisting of the ovary and so forth. But I think we had a specific question from one of our participants is, are there any specific exercises that you recommend in preparation for embryo transfer?
Like I said,
do you aim your exercises towards certain, treatments that patients are going through, or do you sort of see it as a holistic approach, no matter what you're going through? Like, these are some elements that anyone should be doing and that you recommend in any situation?
I think the answer is both, because on the one hand, you always want to treat and work with the person who's in front of you, but you also have these larger principles that you're working with. So, you want to see, what is this person working with? What is this person dealing with? Okay, they're getting closer to their cycle, or getting closer to their retrieval. So in that case, you really want to down-regulate, slow down, focus on the hip opening, which will help to release the low back, the inner groins, the inner thighs, and then focusing on that kind of like downward flow that is eventually is going to be working its way out, whether that's through your own body or through mechanical stimulation. So focusing on hip opening, focusing on reclining postures, especially when you are getting closer to retrieval. I really would not do anything forward folding. I would really focus on being reclined. And then, but for someone who's earlier in their cycle, you just don't have the discomfort that's there, but you're starting to prepare for when someone is moving closer to having their retrieval.
Okay. Is there something that you can practically teach us right now maybe a
Yeah,
certain breathing technique or something that you do in your everyday life, not just related to fertility, but something that can be sort of a panacea, like a general thing that you can do to reduce your stress levels in any moment, no matter what's causing it.
absolutely. So like I was saying earlier, the thing that is most available and accessible to all of us at any time, at any moment, is our body and our breath. So whether you are sitting at your office chair, whether you're laying down in bed, just taking a moment. Actually, let's do it. Let's practice.
Yes,
So
I'll join you.
all right, I'll put both feet on the floor and just go ahead and take your hands, place them into your lap, close your eyes. And we're just going to take our attention to our breath. Starting to feel the soles of the feet grounded to the floor. The buttock bones anchoring down into the chair, allowing us to lengthen, to lift up out of the crown of the head. And then as you start to familiarize yourself with the sensations in your body, start to bring your attention to your breath. From the crystal clear bowl of your pelvis, start to draw your breath up into the sides of your rib cage. Feeling the right and left side of the ribs peel away from one another. Taking your breath, drawing it all the way up to the brim of your collarbones. And then keeping your chest lifted, trace your breath back down to the bottom. We're just going to take 3 more smooth, uninterrupted cycles of breath. From the base of the pelvic floor, starting to draw the breath up. And then very slowly, starting to trace your breath back down to the bottom. Relaxing your mouth. Softening the muscles of your face. Just bringing yourself into presence as you listen into the thread of your breath. And then very gently open your eyes. And welcome back.
Wow. I feel like I just woke up from a wonderful, restful nap. I see more clearly, I think.
It's so easy and it's so accessible, and anytime you're feeling overwhelmed or you just need a moment, just close your eyes, bring yourself into your body, connect to your breath, and then when you come back, like you said, there's this new perspective.
Thank you. No, it was really, this was very, very helpful. I can understand that your practice probably, unfortunately, has been affected by COVID, at least in terms of being able to exercise with other people together. But do you see that coming back? Are you going to be exercising in a studio, somewhere where people can find you? Do you mostly do this online? What is your
Well,
practice?
so COVID has been very interesting in the sense that I have been able to reach more people because of COVID. So I have taken this online, and I have, reached out to people who are not just in New York City, but really who are all over the world. And so if people are interested in learning more about fertility yoga, they can go to my website at Blandin Yoga, and I offer one-on-one coaching. I have group classes that I do with people. Those are online, so you can join from anywhere at any time. And the nice thing about those group classes also is that they're recorded. So we meet once a week, and then you can take that recording with you, practice it at your own time, on your own convenience throughout the week until we meet again. And that is a great way to, you know, you're not just relying on the class, you're not just relying on the teacher, but you can make this your own. And that's really what the yoga practice is about. You want it to work for you.
Excellent. I will definitely share this once I post the live. I will definitely share your website and your contact information, but obviously people can reach out to you through Instagram as well. Um, I just wanted to ask one more thing from here. I guess, again, is there anything different in terms of, obviously we have people who are already on the path of, you know, needing treatment, going through treatment, but let's say we're talking about, you know, a couple who is just starting to try to conceive. Are there any specific exercises, yoga, type of meditation that you think might enhance natural fertility? Have you ever come across anything like that?
So hip opening is very conducive to conceiving. So again, there's all kinds of different things that you can do. Laying on your back, drawing the soles of your feet together, putting your hands on your belly, connecting to your breath. There's things that you can do, again, laying on your back with a strap, stretching the hamstrings, opening the groins. And these are all different ways that if you know if you're not quite ready to jump into a full yoga class, but you want to start to explore your body, want to start to explore these sensations, these are some great ways to do that. And you can find all of these things on my website as well.
How often do you recommend people to practice? How often during the week? Do you recommend daily practices?
Ideally, you want to work up to that daily practice, but that's not always available for everyone, you know, whether it's time or, you know, different responsibilities that we have. But if you can work up to at least a 3-day-a-week practice, I think that is a great way to start really acquiring some of the benefits of this practice. It's tough if you just kind of jump in and jump out. You know, you might stand up right afterwards and feel great all of a sudden, but again, we're growing, we're building upon these foundational skills and practices, and with time you'll start to see the benefits. They'll affect you on a much greater level.
Any final pearls of wisdom for our participants and for our community? You don't have to. I'm totally putting you on a spot, but if there's one thing that, you know, words of encouragement or hope for those going through treatment or infertility, anything?
So, you know, while I'm here and I'm touting and espousing fertility yoga, and I think that this is really great for people who are going through fertility treatments, I always want people to know that you know your body best. So listen to yourself, listen to what your body needs, and ultimately you know what's best, and to trust yourself.
That's wonderful. Thank you for saying that. I think that trust in yourself is often tarnished for so many of those going through treatments, and the, you know, pessimism sets in, and that feeling of not enoughness is something that eats you alive. And I think it's so important to remember that you are enough, you are strong, you will have this baby. What I like to always tell my patients, and probably everybody who's ever met me knows about this, that I usually say that, you know, if two guys can walk out of my office with the baby, anyone can, right? So, right? So anyone can. So anything can be, anything can be, we can pursue it in the setting of any possible combination, any possible factor of infertility. And this field really does have the ability to treat 100% of its patients. So it just might be, you know, a different therapeutic option from what you hoped for, but ultimately I think it's so important to be focused on the goal while going through these treatments and while going through this hell of infertility, just being focused on the goal, just seeing that baby, seeing that family, because ultimately anyone can have a family through a different approach and through a different path. So
Absolutely.
well, Lauren, thank you so much again for finding the time. This has been really, really helpful and very novel. And I'm so amazed and proud with everything you've done, especially in the
Right.
recent year or two since you've been doing fertility yoga. I will share your contact information in our live, so anybody who wants to reach out to Lauren and ask any further questions or just follow her and follow her advice and her exercises, you can do so here or through her website. I'm hoping that we can do maybe in the future a slightly different live where we could potentially show our participants some of the things that you do.
I would
But
love that.
would
I'll
you be
sit on the
interested?
floor. I'll get you set up.
No, I think it will be great to just demonstrate some of the things. And I mean, I would love to learn how to do some of these things as well. But again, thank you for finding the time. I wish you a wonderful day, and we'll be in touch, and then we'll hopefully be planning our next live in the next couple of weeks.
Wonderful. I'm looking forward
Okay.
to it.
Have a great day.
Bye-bye.
Bye, all. Have a nice day.